No,
Yeah,
I have another question for you.
of course you do.
What is bad Botox?
Let's start with the first one. It didn't work. It's a very rare thing. I've only come across 3 patients in my own patients where a toxin, not always Botox, but any one of the toxins did not work well for them. So that is a possibility. I think it's very, very rare though. I think that sometimes maybe they go places where the product wasn't stored properly, is old. The other thing is that it didn't give them the result that they wanted. You have to know how to inject Botox. You have to understand the whole concept of it. It's not just simply you have a wrinkle and you inject into it. You have to understand that this area is very dynamic. We have a muscle that lifts the brows, and then we have muscles that drop the brows here and also create these crow's feet. So when they're coming in, sometimes it's that it didn't address certain lines. Well, if it didn't address this line that's all the way out here, that's because you can't inject this line. This line right here is what's lifting your brow, so maybe your brow is low. Sometimes they're looking for these crow's feet. There's these crow's feet, but there's also these. And these don't really respond too well to Botox because here you're elevating the cheek when you smile. So if you Botox and paralyze your middle face here, your zygomaticus, and your smile is just like this, you're not going to have these, but that's not a good trade-off. And so the other thing is, most of the time what I see is over-injection, and again, not understanding the actual dynamics of what happens here. They see wrinkles, they just inject wrinkles, and you can't do that. It's got to be a balance. You have to inject the forehead in such a way that you improve these wrinkles, but you still allow this muscle to do what it's meant to do, which is raise the eyebrows. This area here, you can paralyze this, that's totally fine. Some people like a little bit of movement. As you see, I have very minimal, but this muscle pulls down on the brow, so you want to make sure to get that over here. This one here allows the eyebrow to drift up, and it's a balance. Most of the time, bad Botox is an uneven distribution where the brows are typically too low, they get this sad look, they're overly frozen, or they're too surprised. Although I'll take that too surprised look over the low brows any day because that's easy to fix. If these are too far up, no big deal. You put a few tiny little units here, the brows go back to normal. If the brows are dropped, sorry, you just gotta wait for the Botox to wear off. So that's where I think the bad Botox, it's not understanding the dynamics of the face here.
Thank you.
Yep.